Okay, so thank you everybody so much for being here today. We're really lucky today to be joined by Louis Philippe Noel. Louis Philippe Noel is a seasoned technology entrepreneur celebrated for his strategic prowess and visionary leadership. LP has concluded two successful exits and won several recognitions, including finalists for E&Y Entrepreneur of the Year Award. LP has a degree in law and entrepreneurship programs from École d'Entrepreneurship de Beauce and MIT's Sloan School of Business. In 2019, Louis Philippe founded BioTwin, a trailblazing technology company dedicated to revolutionizing healthcare through human virtual twins powered by proprietary AI technology. BioTwin's innovative approach promises to redefine health management with a focus on prevention, proactive insights, and clinical decision support tools, marketing a pivotal shift in the landscape of healthcare innovation. So thank you so much for being here today. We're so glad to have you. And sorry, you're just on mute there. So I will pass it over to you.
Hello, everyone. It's a pleasure to be here. My name is LP. Louis Philippe, but I go by LP in English. First off, I need to say, unfortunately, I have to take this call from my car. I reassure you, I am not driving, but I just had a lower back hernia that had a major sciatica problem this morning, and the only doctor I could find was an hour away. But I have good reception, and we should be okay. And I've got a great presentation for you today. My goal today is to present what we do at BioTwin, and I'm gonna start sharing my screen. Just want to make sure you guys are seeing my screen.
Yep.
Excellent. Okay, so what we do at BioTwin is we created human virtual twin. It's quite novel technology. It has tremendous potential. And the first application is in oncology. And we have a research project that's covering pancreatic cancer. So that's sort of my goal today, to present what we do high level. I do have some more scientific slide I'll be happy to go into. But down the road, it's a presentation that's for you. So we'll open it for question. And I want to make sure I cover a bit of everything. First disclaimer, I am not a scientist. I am not a doctor. So this is not a presentation for medical advice. BioTwin has some great scientists, as well as we're surrounded by great medical advisor, but they're not here with me today. Today, I'm the technology guy presenting the technology. And before I start, I also want to mention one of the reasons why I really wanted to be in the pancreatic cancer, and it's one of the motivation for me to founding BioTwin, was my next door neighbor. His name was Jean. When Jean was 55 years old, he was one of the most healthy and I must say good looking person. I was looking forward to aging the same way he was doing. But unfortunately, Jean started having some small symptom, nothing too big. But it took 7 months for their doctor to realize that it was pancreatic cancer. And you'll guess it, he was diagnosed in the late stage 4. And Jean is not with us today anymore. And I think his biggest frustration was not to be able to be diagnosed before. And luckily, well, I don't want to say lucky for him, but he had some small symptom. So that was one of my motivations, that there must be a way, there must be some biomarker, some way to be able to early detect pancreatic cancer. And you'll see down the road my presentation what we aim to do towards that. So BioTwin, virtual twin technology. I'm the founder, general manager. This is my fourth business, all been in the technology field. And as you can see in the bottom, BioTwin is supported by IBM, Amazon, Google, Microsoft, Op71, and I'll go. I presume you'll understand why down the road. Let me just switch to the next screen. There we go. What BioTwin is tackling, what we're bringing to the market, is a precision medicine. So what we're helping is to bring a more participatory, personalized, preventive, as well as proactive medicine. As of right now, I'm going to be talking to Canada. I know a bit about the US system, but if you don't have any symptoms, they're not going to treat you. We have a slow, it's a reactive system. So does it hurt? It's a trials and error. So we're helping clinician bring a high value care solution to the market. The technology we're using, it's called digital twin. digital twin have been around for over 60 years. It's actually NASA who created the first example of digital twin. For those of you who saw the movie Apollo 13, they recreated on Earth what was happening in the space. So that's sort of the first example of a digital twin. Since then, it's been applied to a lot of industrial sector. Every plane in the sky has its own virtual twin on the ground, personalized to each and every plane. Because if I take a flight Montreal-Paris, we're not going to have the same amount of passenger. We're not going to have the same weather, the same luggage load. So you can personalize each usage of the plane. And that information is assigned to technician, to engineer, so they can take better care of the maintenance, prevent damages, and overall it optimizes the fleet. So that's the kind of technology that we're now bringing to human to create a human virtual twin. More concretely, what does it do? Well, it helps for prevention, early detection, remote monitoring, longitudinal data,
Okay.
forecasting, treatment assistance. So that's what we're bringing to human. Technically speaking or legally speaking, BioTwin offer a clinical decision support tools. Our client is a health professional. We're helping them make better decision by pancreatic cancer, informing them there might be a cancer. But we've got other application, which is one of our challenge. Technology can be applied to a lot of conditions. Uh, we started 3 years ago, but I'm happy to report that more and more digital twin initiatives are happening all over the world. I'm going to be talking next Monday with a European conference group just about human virtual twin. The NIH in the US has made a few congress. So more digital twin are coming to medicine, and that's a great news. Um, how do we create a virtual twin? There's a lot of way. BioTwin's case, we'll be sending user a free kit, and it might not work really well with the blurring, but so that's the kit. If you look at my camera, we're sending that by the mail. It's free for the user. What it contains, it's what we call a dry blood spot. So I'm gonna put it on the camera. You're not gonna see it perfectly, but you simply you have a lancet, you pick your finger at home or work, you put a few drop of blood. We also do urine and saliva, but it's mostly blood. Put it back. You have a return envelope at no cost. Drop it in any mailbox. It comes back to our lab. And at our lab, we can track between 100 and 200,000 biomarker. So that's where we recreate you virtually. We also connect to various wearables, and you can see I'm wearing 4 of them. So I know about them, and those information helps complete and create your virtual twin. Uh, one of the biggest advantage of BioTwin is our technology for collecting your blood. You don't need a doctor prescription. You don't need a nurse. You don't need a blood draw. So you do it at home. Our envelope contain 10. So 10 blood draw in a matter of a few days. It brings us a lot of data, which our AI need. And you can see at the bottom left, in less than 3 years, we surpassed 36,000 samples. So which we need a lot of data for our AI. It's also makes it really affordable and easy to do. So that's one of our technology greatest advantage. What's the science behind BioTwin, the twin we're creating? As I mentioned, it's a mix of biometrics of different medical metrics, your medical file information about your medication. And in terms of biomarker, I'll go in details, but as of now, our focus is metabolites, and you'll see why in the next few slides. Down the road, we'd like to add proteomic information and some genetic marker. We're not there. That's not our focus. We're focusing on metabolites information. Why is that? Well, first of all, what are metabolites? So your genome, your DNA, are instruction code for your cell to produce proteins. So we say proteins are the basis of life. Your proteins will generate or will be involved in the generation of metabolites. Metabolites are sugar, amino acid, lipids, all the foods. Basically, what your body metabolizes ends up being metabolite. So if you think of potassium, iron, caffeine, all of the hormone, testosterone, estrogen, those are all metabolites. There's an estimated 4 million human-related metabolites. As of now, science has only identified close to 300,000. The best lab, will detect maybe 20,000. And your family doctor, in a best case scenario, will be able to measure or track. I'm generous when I say 100. That's mostly endocrinologists. So there's a big opportunity to know more. And here's our process. So typically, the way we track our biomarkers, so how can BioTwin be able to track a few 100,000 biomarker without them not necessarily being identified by science? What we do is right now, if you look at the left, the tree you see in the forest, that's what current science is. You want to test your testosterone, you want to test your cortisol, you'll have a lab done, and it's one test, one result. So we take one tree in the forest, and that's what we measure. What BioTwin is doing is what we call profiling. So if you take different picture of a forest, which you have in the middle screen, if you give enough picture of a forest to an AI, it will be able to predict which trees change color, when do they change color, which are going to lose their leaves, without even knowing the type of tree. So that's the type of technology we're doing. We're profiling your different biomarker, and we're creating signature for specific disease, pancreatic cancer, for example. So what's unique about BioTwin that other company or that it actually doesn't exist on the market yet? BioTwin will do untargeted. When we do untargeted, we're looking at 100,000 of those metabolites that we profile together. Um, we have a technology that's highly scalable. One of my goals today is to convince you to participate in our research project, which is free for you. But if you were to invite 100 of your friend, which would invite another 100 of your friend, we can all manage that. There's no limit. We're looking forward. We already have a few thousand user. We're looking forward to be in the 10,000s of user. So that's what's unique. And the first application of our technology is for early diagnostics. Um, we're not the only one doing human virtual twin. We feel that we're the most advanced in the world to the best of our knowledge. What exists right now would be similar. On the left, you have a lab company. So those Everly Well, it's basically all the tests that will be selling on Amazon. So if you want to test your hormones every month, yeah, you could do so. That's similar to BioTwin. It'll cost you a lot though. Grail is a early cancer detection test. That's about $1,000. You need a physical blood draw, but those are similar in the way that the different biomarker that they'll be tracking on a recurrent basis. The other one, I call them twin data aggregator. So what they'll do is different company that basically will aggregate all your existing data and put them together. QBio will take imaging. Twin Health will take a specific blood draw result for diabetes. Sanome will take your medical file. So they all make sense. And I'll give you my personal opinion. I think down the road, all those companies will merge together to create the ultimate virtual twin. But as of now, BioTwin is the only one to combine creating new data, lab tests, with the virtual twin concept. To tell you a bit about BioTwin, it's been 3 years. What have we done in 3 years? I'm happy to report that we can very accurately screen for breast cancer. So early detection of breast cancer. We have 2 scientific publications. We've got 3 patents of our technology. As I mentioned, 36,000 samples, which you need to do the kind of AI that we do. We've got 11 research project. We've got an offices in Abu Dhabi, United Emirates, and a great project, which I'll tell you about. Close to $9 million that we've raised. That's one of the challenge, being especially in Canada. We've got some member in the US. In full transparency, as the founder, I regret not starting this business in the US because we would have had so much more financing so much faster. But so far so good. Now, before I present you our cancer, I want to show you what we've done with the technology, how accurate it is. So I told you that we can track hundreds of thousands of biomarker. We took one that everyone knows. So this is cortisol. What you see on the right, the small graph, that is what you expect of your cortisol level. Cortisol level raise early in the morning, and then it goes down during the day. What you see on the left, we took at random 3 patients and we track their cortisol level. And that represents hundreds of samples. And you can see that what we're seeing is exactly what we're expecting to see. The small bump probably represent dinner or coffee at lunch, which would correlate with a small increase in your cortisol. So even though BioTwin is tracking hundreds of thousand biomarkers, um, we're precise tracking one of them. So, but then again, BioTwin will never replace a lab test, and we're not aiming to do that. But I want to show you how precise the technology is. I'll give you another example, a trivial one. So what you see on the left, that's a mess because that's the level of caffeine in hundreds of different users. Why is it a mess? Because everyone takes their caffeine at different time of the day. So on the right, we're zooming on one user. And if you look at the time of the day, 9 o'clock would presume they had a coffee. I'll say coffee, but it could be energy drink. And then I would presume that person had probably a smaller coffee at 7 o'clock at night, um, but it just show that our technology can track that. Um, and when we take one biomarker, you see on the left, those are all different biomarkers that we can track. All of those biomarkers are related to different condition, different disease, but also at the right, those two right columns, every biomarker are linked to other biomarker. So the human body works, all the biomarker works in parallel. If you have one hormone that's down, it's going to either bring down some other one or some other will compensate to keep a homeostasis in the body. And that's the strength of BioTwin technology, is that we track all of that. We're creating a profile. We're not focusing on just one. That's one of my favorite examples. So that's another proof of technology. And what we've done there, every color or every spot is a user. And within every spot, you're seeing some small dots. Every dot is a sample that a user has given us. So what you see is that our AI can recognize each user samples. They put it together. If we were to zoom in on any of those users, you would see that every dot are really far apart. What that means is that every one of us is extremely variable instead of those in terms of those biomarker, but we're all variable in unique way that allows our AI to identify everyone. When I'll go back a bit, but I did go quickly over DNA versus metabolites. When you analyze your DNA, you only need to do it once. And an example I like to give is Angelina Jolie, who had, well, she still does, has three um, marker for breast cancer. And those marker correlates with a really, really high probability of having breast cancer. But what genetic doesn't tell you is when will you have it? You know, she's not gonna have cancer at 8 years old, and she's not gonna have it at 80. But when in between, it's a really unfortunate that she had to have a preventive mastectomy on both of her breasts, but there was no other option for her. When you track metabolites, metabolites directly reflect what's going on with you today. So when you detect metabolites from a cancerous tumor, that means the tumor is there. So metabolomics are not into a risk factor. They're into what's happening with your body right now. So that's the strength. And it does reflect your environment, your nutrition, your physical health. If two identical twin give off samples, they'll have a different profile because yes, their genomic is identical, but they do not eat the same way, they do not train the same way, they don't have the same health condition. So that's one of the difference. Um, those what you see here, those are the first result from our AI. Um, they're part of what we call lifestyle medicine, what I'll explain on the next slide what is lifestyle medicine. But early on, we had a clinical trial and that demonstrated some of those results. So BioTwin, with a few drop of blood, were really accurate to track, to detect the gender individual, the age, the height. Blood biomarker can give us the height of someone, their weight, their body fat, water composition, and what they eat, information about their physical, about stress management. So there's a lot of information that we can get from those biomarker, and we're actually quite accurate. The good news about all of those results is they're part of a field of medicine, but they do not require FDA or Health Canada approval. So those are results that we can provide user right now. What you see here is a snapshot of our first medical condition. I say medical condition, but I must say for us to be able to offer our service, we decided to go the FDA and Health Canada approval road to give us credibility. And we're in process. Breast cancer will be our first medical condition to be approved. So you can see right now, if I look at breast cancer, just 26 user that gave us close to 1,000, samples were 81% accurate in detecting it. We have quite low positive and negative rate. I'll talk about breast cancer, but after you have anemia, diabetes, we have others. Those are just the first one that we're sharing publicly. Uh, Finally, I tell you about our oncology research project. Um, so what the project is about, it's focusing mainly on 6 cancer. Two of the most common one, breast and prostate cancer, and four of the most lethal one in terms of survival rate, pancreatic, colon, lung, and ovarian. And one of the reason why they have a low survival rate, it's because most of them are asymptomatic and they're very often detected in the late stage. And you all know that survival rate changes drastically, stage 1 versus stage 4. So if you look at the lower right, our project has 4 expected outcomes. The first one is early detection. And then we want to assess prognostic, but mainly complementary information on diagnostics. So we want to be able to detect, are you a stage 1 or a stage 4? But most importantly, how aggressive is it? Are you a stage 1 or going to go stage 4 in 4 years or in 4 months? Be able to assist for treatment decision. If I remember correctly, I think ovarian cancer, 88% of women who do chemotherapy does it unsuccessfully. And right now you flip a coin. Will it work for you? Will it not work for us? One of the goal of our technology is to be able to tell the clinician that woman has a 60% her profile correlates 60% with the woman who successfully did the treatment. So that doesn't mean she should do treatment. That's up to the clinician and the patient to make that decision. But we provide information that they do not have right now. So that's our goal. And you'll understand detection of early detection of early pancreatic cancer. I'm looking very much forward to that one. More concretely, I'm not going to go into all details, but there's 3 phases to our oncology research project. Stage 1 was the proof of concept. There's a lot of literature about creating signature with cancer. We call it untargeted metabolomic profiling. You can find it on pancreatic cancer. You can find it on several cancer. Phase 1 was to demonstrate that BioTwin technology was able to create the same signature, which we did successfully, which led to phase 2 that was announced publicly with the Health Minister of Canada. It's $1 million project, finance 400,000 with the federal government, and the goal is to create signature for all of those different cancer. Phase 3, which will be announced shortly, but might be reported to you, is the validation phase. Once that we have signature, we do validation. That means we're collecting samples from the population, and we're hoping to detect cancer before the clinician. And when I say detection, BioTwin does not have clinician. We're not the one doing the clinician. We're informing clinician or the user to go consult their clinician. And I'll talk more in details. Breast cancer is the most common one. We have a clear signature and we're moving into validation. Pancreatic cancer, we're unfortunately missing more diagnosed patient. One of my goals today is to be able to recruit currently diagnosed patient, in remission patient, and at-risk patient that would like to follow. And again, research is all free. You can do it at home. I'll have a small note for the person in the US on how to proceed. This is the validation Russian. It will be announced within the next few weeks, hopefully next week, but we'll see. So we have a project with the Cleveland Clinic in Abu Dhabi. Dr. Grotmeyer is an oncologist. He's actually a scientific advisor for BioTwin. The Cleveland Clinic will be sending us 120 user, and it's a blind validation. So we don't know which one have breast cancer. We'll have 50 patients with breast cancer, 50 healthy, 20 with colon cancer. BioTwin's goal is to be able to detect each of them accurately. And the good news, why are we in United Emirates? Well, they actually invited us to go there when they heard about our technology. They're paying us, offering an office over there. So it's great condition. but technology moves really, really fast over there. Um, the United Emirates was the first country to scientifically approve the COVID vaccine. They move really fast when they like a technology. And this projects, we work hand in hand with the Department of Health. We got their support, and they're actually more looking forward than us to commercializing this technology in the United Emirates. Uh, as a side information, those are other research project that we're doing. And for you to understand the I'm going to say value, that's not the right word. I'm not finding the English word, but the potential of the biotwin technology. If you look at the upper left, we can see we have over 600, I think it's 660 user who has cardiovascular condition that gave us samples. 585, if I remember correctly, who have a cancer-related condition. So what's good about our technology is the more user we recruit, everyone has different uh, health condition. Our AI is able to customize and learn from that. The more samples we have, the more precise our AI becomes. And the more user that sends us samples, the more we're precise, the more we can personalize the technology. So that's the benefit. And I'm happy to report that we're selected by the Canadian Google Accelerator, which we're part of. And through them, they're going to help us organically grow to 10,000 user, which we need and we're in the process of. Sometimes people ask us, can you use biobank, phenotype biobanks? Yes, that's amazing, but those biobank cost a lot of money, which BioTwin unfortunately cannot afford now. But we're in the process and raising money, and that's on their roadmap for the next round. Right now, we're going recruiting with the Patient Association. Presenting to you today. In November, we're presenting to the Lung Cancer Association. Um, I'm gonna show you. I'm gonna open it to question. But before I do so, I'm gonna present to you our user experience. What you see right now is our portal. So if you go to biotwin.ai, you can create your twin. You can also go on twinme.ai. It's the same company. TwinMe is the process of building your twin, which your clinician will never be involved with. Your clinician will never bother with those blood samples and all of that. That's all TwinMe. When you go see your clinician, you have health result coming from BioTwin to make a decision. So Twin means the portal. The first step, you order your free kit, the one I show you. Um, so person in the US right now, unfortunately, it's not a free shipping. We can work in the US, there's no problem. The only issue is you'll have to pay for shipping back, which is about $8 to $12, unfortunately. But we'll have a free shipping in the US early 2025. So you have we show the kit. You can connect different device. We have different questionnaire, and what I'll show you is the result that we're giving our user right now. Um, we're giving user right now early result in lifestyle medicine. What is lifestyle medicine? Lifestyle medicine is the only field of medicine that's working towards preventing disease as opposed to fixing or curing a disease. Lifestyle medicine has 6 pillars of medicine, which you can see there. BioTwin has created score, biological score, that are derived from those 6 and we're quite accurate. Um, and I'm going to show you those score. So what you see here, that's a screenshot of our portal. And if you log in, you'll have all the details. We have a biological age. We just added 6 new score. 2 score in sleep management, one related to the sleep duration, the other one to your sleep quality, and then nutrition. We can quite accurately guess your biological weight. So when I do presentation, I'm not doing it right now. When I log into my profile and I click on biological weight, it tells you in my questionnaire, I put my weight was 180 pounds because 2 years ago, that's what I weighted. Unfortunately, I'm saddened to report that I weigh 200 pounds today, but the AI can guess it accurately. So it would show in my portal that I'm 201 pounds. That's the bio micro prediction. It's actually quite accurate. We've got your percentage of body fat, body water. We can guess your nutrition plan. That's less accurate because it's a lot more variable. There's so many variation nutrition plan, and people change all the time. We have score for stress management, physical fitness, and at the bottom are risky substance. So we can tell not only is there caffeine in your body, but how fast is your body metabolizing caffeine? Are you really fast 4 hours, or is your body takes 12 hours? So those are the kind of result. Why are we giving that for free to user? Because we want to thank them to be part of our research project. And we also want to encourage them to be involved in research. I presume that all of you have a great interest related to pancreatic cancer. So you might not need those score to say, I'll be supporting and I'll be helping in the research project. But if you share with your friend and family, they might say, you know what, I'm not sure I want to give a drop of blood. I'm not willing to do that. But if you tell them, well, they'll give you for free a snapshot of your health. And obviously, down the road, we'll be able to share those results with your clinician. Because what is better than preventing cancer? Well, it's preventing it. And what can you do to prevent a disease? Well, you can act on your nutrition, you can act on your sleep, on your stress, well, on the factor of lifestyle medicine. Um, That's a quick snapshot. You can connect up to 150 or almost 300 third-party application, whether it's Apple Health, whether it's Garmin, or all of those watch. And it really helps your AI understand more your biology. So if my AI see that I'm doing 20,000 steps a day, well, I may have a faster metabolism than someone who's doing only 2,000 steps a day. So those information is helpful to personalize your twin and down the road personalize your care. Uh, those are the 16 different questionnaire that we ask you. They're optional, but the more information you give us, the better we can personalize your twin. What's really important in this case is you see at the bottom, we have a number 12 cancer project related questionnaire. That's the most important one. We ask detailed information about if you're diagnosed, if you're in remission, if you have a family, you have cancer. So it helps understand our AI to create a signature. Um, that's my conclusion, and I want to open it for question. If I'm to summarize what we do, BioTwin is one of the most innovative technology um, in medicine. There's others. We're not the only one doing early detection, and actually, all those they're all complementary to one another. Um, what we do is, I'll leave you with my vision. Our dream at BioTwin is we believe that one day we each of us going to have our own virtual twin for medicine purposes. Is it 10 years? Is it 5? Is it 15? We don't know. But one day we'll have our own digital twin for personalized medicine. And we also believe that we're not going to have 20 companies doing that. If I convince you to give me a blood draw every week, every month, every 6 months, you're probably not going to start over with another company. So you either have an iPhone or Android. That's why I want to convince you to start with BioTwin. Even though you're not at risk of cancer, one of the advantages of taking a health snapshot today is that 3 or 5 years down the road, you'll be happy to say, where was my level today? And I'll need to stop because I can go for a long time. But one example I like to give is testosterone for men. If you go see your doctor to have your testosterone level when you're 35, 45, they don't really look at the standard. What they need to compare they need to compare you with yourself. So you might be within the range, but if 3 years ago your testosterone was through the roof and today you're within the range, well, actually, there's a decrease. That's abnormal. But if we don't have that level from 3 or 5 years ago, we can compare that. So that's one of the advantage of starting your twin early. Um, I'm going to open it up for question, which I hope there's many. Feel free to ask on any. I'm not a doctor, I'm not a scientist, but I'll be happy to answer any question you may have or not.
I know Ben had asked, so for smartwatches, he has a Fossil smartwatch. Um, and he said it didn't work. He's wondering how to connect the apps. He already did the whole process.
Awesome. And so Ben, was the fossil watch available in the portal? Was the fossil trade app or
No, no, it wasn't. It's just a smart. Like I do have a Fitbit that I don't wear, two Fitbits that could connect, but I do have it's a Fossil smartwatch, but it's probably
uh,
one that you don't. So if I have an Apple, like my Apple phone, it has health. Would I connect that way?
Yes. Yes. If the way around, if you're yeah, and I just confirm, unfortunately, we're not compatible with Fossil. Um, what you can do if Fossil is compatible with Strava or with Apple Health, then
Yeah.
Apple Health will be able to share because you actually own your data, so it can work. We can have it through Apple Health.
Okay, so I already sent my blood in this week to you. I might have made it.
So
Do I need to send 10 of them in? Because I only sent 7 in because I forgot it. And are they consecutive days or do I take it twice a day? Does it matter?
Um, so I'll share a small secret with you. Um, and you know what? I'm telling me that my laptop might be out of battery. If ever you lose me, it'll give me 1 minute to log in with another device. I don't think so, but just in case. So seven is our minimum is actually 5. We offer you to take 10, and once a day is what we suggest. What's important is we don't want user to have the kit and have it sitting down on the desk and wait 3 months before sending back. So it's important to send it back rapidly. And what we want is we want to be able to track your different variability, whether it's every day, but if you want to take in the morning, you want to take at different moment, that's okay. There's no necessarily preset. What we ask for the first kit is take 7 once a day, and the 3 are extra. They're not necessary, but if you take them, we'll analyze them, and it will help just provide more information.
Okay, so I can go back to your web page and link my Apple Health with my watch
Yes.
that's been tracking everything. So I can go back that and it's going to tell me something, or is it going to upload it to you?
It's gonna tell you something. So, well, it's gonna tell you the exact same thing Apple Watch is telling you. So we have a section where we tell you your biometric information. But you have it in Apple. Once we have your biological information, it'll allow us to make it more precise. You'll see your twin precision level will be more precise. If you were to wear more than one wearable, so if you're, I'm sorry, Ben, did you say something?
No, sorry, I just moved.
Okay,
I'll
I was
move.
gonna say so. If in my case I'm wearing 4 wearables, I've got the ring, I've got a few different one. Why would I do that? Well, I'd like to test them out, and you'd be actually quite surprised to see that they don't give you the same information. When I wake up sometime, this one will tell me, oh, you had an amazing sleep, I'll give you 100%, where this one gives me 50%. So for us, because we're using the information, I wanted to be a full or accurate they are. Heart rate is where they're the most precise. They all have the same sensor, but then they have different algorithm. So if you have more than one, the BioTwin will allow you to compare all of them because we show you all your biometric information that you give us. We put it there and you can compare them. But which Apple is giving you. If you only have one, it's not really worth it, but we give you that information. That's an amazing question. So I'd like to answer when people ask me how often should we send samples. I answer back with a question, and I tell you, if we were to be able to detect early on 6 different cancer, how early would you like to know? Once a year, every 6 months, every 3 months, or every month? So, it depends. If you're 25 years old, you might not be that worried. You'll give us once a year and it'll be okay. Right now, we had to limit to 1 kit every 3 months because we had too many people ordering. So we wanted to limit because we have a lab delay that's between 3 to 6 weeks, and we want to prioritize new user as opposed to recurrent user. Not that sending more sample just make it more precise, but so it's up to you. Once every 3 months is okay. What's important is to send the first kit rapidly, so at least we have initial profile. I'm also going to answer a question that we get asked sometime is, will a insurance company one day look at BioTwin and say, you know what, I'm not insuring you because your twin is not healthy? Well, let me reassure you that we're not sharing any of your data with third party. Any data that we share will require your consent, even with your health professional. So once we'll be able to commercialize with Health Canada approval, we'll need your consent for your health professional to follow you for early cancer detection. The business model with insurance company, what the insurance will tell you is that if you're being followed by BioTwin for those 5 different services, will reduce your premium 25%. because if we can early detect those disease and assist for treatment, it will save a lot of money. So that will be down the road, the model, because biotwin is not a risk factor. Biotwin directly reflects what your twin is. So if your twin is not healthy today, uh, well, start training, start eating right, and you can change it completely. Ben, I noticed you put a question in the chat. Do we get a new kit every 3 months? You need to order one whenever you want one. Right now, we're limited every 3 weeks. I'll be honest, down the road, we'll limit every few months because we have limited capacity in our lab, and we want to make sure we check a lot of user. But feel free right now. You can order one every 3 weeks.
Okay, thank you.
No. You don't even need to fill out the health questionnaire. You can just, the minimal information we're asking are those biological samples. Uh, if you do have those, or your twin or AI will be more precise. It will help better understand you. But since we have a lot of users who already share that information, we can, from your biological samples, I can pretty much guess your weight, your gender. I have a good idea, but you might be exceptional on a specific profile. So it will help, but it is not required to do so. I'm gonna talk about oncologists or family doctor or a health professional in general. 90% of them are extremely happy. Why is metabolomics is one of the science which is not available to them. It's very expensive to do tests. It's mostly just targeted tests, so it's very limited. If I go to United Emirates, where they have almost unlimited budget, they're sequencing full sequence the whole population. That's $3,000, but they're almost not doing any metabolomics. It's complicated. You need a lot of AI. So yes, the 10% I'm going to say are indifferent or do not understand what we do. It's you need knowledge from AI, from metabolomics, for different field of science to understand what we do. And 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 you also need information about FDA approval and so forth, because we're not a diagnostic test. We're just a helper clinician. So, but 90% of them have a really good, they're really happy, they're anxious to move forward. Um, It doesn't matter that much. It would be ideal that when you wear it, you have a blood sample, so the connection is closer. And I'll make the same mention. If you do not have a watch, it doesn't matter. But if you can get a hold of a watch, or if you have one, we actually just need a few nights of data. Because when you keep it for a night, if your friend lend you a watch for 2 3 days, we'll get information about you sleep. We'll get information about your resting heart rate. We'll get to just 1 or 2 days. If you can do it at the same time of the sample, that'd be ideal. That's going to greatly increase the precision of your twin. But when I say greatly increase, 80% of your twin is based on the biological data. So that's the 20% remaining. Those are the questionnaire. Those are the so it's good. But the biological data is crucial. Like, we wouldn't do a twin with just the watch. So Fitbit is supported by our application, but would we do a twin with just biometric information? There's some company doing that. The problem is quite limited. You cannot provide medical information. You'll be able to provide some wellness information. Say, hey, you should do more activity. You should do this, or it's limited. It'll be able to give you. Basically, it's similar to what Garmin or this is a Whoop. So there's already watch or I don't know about Apple that gives you that sort of coaching you. So that's the best you can do at a coach. And I'll share with you a small preview. With our collaboration with Google, shortly we'll be adding what we call an LLM. So when you think of ChatGPT or Gemini from Google, that will be able to answer any question you may have about BioTwin, about your samples, or about your score, the current score we're giving you. They'll give you a recommendation. If I give you your fat percentage is high, yeah, what can I do? Well, I'll give you a recommendation. It's
Right.
nothing different than if you go to ChatGPT, but the AI will be able to look at all of your results, your questionnaire, and your biometric, and personalize those recommendations with everything that you're giving us. That's still going to be free. It will not provide medical information, but well, medical advice. It will not replace the doctor, but it'll be something great. All again for us to convince to bring more user into our project research project. We're gonna send you 10 in the envelope. Uh, we're gonna ask that you send us back 10. We'll in the instruction, it says you have 7 and you have 3 spare because it may happen something, it may not work. But the more you give us, the more it is. We'll ask for a minimum of 5. 5 is really the minimum to have a precise winner. Our first scientific publication, we reported that when user give us 5 samples, we're 82% accurate in recognizing them, and when we have 10 or 96% accurate.
Wow.
So
Wow.
82 is good, but the more we have, the better it is. And actually those numbers are probably higher now because the more overall user we have, the better it is.
That's tremendous.
Yeah, and
So
and one don't yeah, go ahead.
how do I sign up for it?
Are you in the US?
I'm in Canada.
Awesome. You simply go on our website, whether it's biotwin.ai, whether it's a TwinMe, and you'll have a link for the portal. And you create your account. When you create your account, you'll see there's a list of, I think, 7 or 8 research project where we'll ask you, do you want to be participate in those research project? The only reason why we're asking you is that if you give me your consent, if I see something abnormal with your profile, I need to inform you. So as a man, you may say, well, I'm not going to participate in the woman health project because I'm not a woman. We're asking you to do so. Obviously, you're not a woman, but you'll be useful as a reference user, which I don't need your consent for. Well, we have your consent in the research form, in the user agreement form. But the reason why we're asking you for that consent is, let's say during the woman's health, we're going to be tracking, you do have estrogen in your body as a man. If we're seeing if we're seeing something abnormal, if we have your consent, we'll be informing you. If I don't have your consent for women health, I won't be informing you. So it's still up to you. And if you don't want to be informed, if you have a condition or you may have something because it will make you anxious, do not give us your consent for that. That's why we're asking you if we can inform you.
Okay. Cool.
I see Patricia said here in the chat, very intrigued. Also, completely agree with you in reference to lab ranges. Doctors do not even look at or acknowledge unless something is flagged as out of range, and then only barely and still not typically addressed, depending on the test.
Yeah, that's exactly it. And that's one thing we bring is personalization. You see all of the information you can do. We're not there yet, but eventually when you do a kit, we'll ask you, we have some food diary application that are free and compatible with you. So we'll ask you, when you do your BioTwin week, when you take a sample a day, fill out a food diary, which by the way, those are the worst thing you can do. I was never able to track down for more than 3 weeks. But if you do it for a week as well as the same time, it's a free application. It just help personalize everything. Maybe in your case, you don't metabolize this food this way or this way. It'll help understand. And we do have a research project in food tolerance and allergy. So it just will help. And I you'll see I'm really passionate about what I do, what we do. And one of my motivation I told you was my neighbor. If I take a step back, I think BioTwin's going to be a life changer in technology. We're not the only one. There's a lot of new technology coming. Unfortunately, Canada is one of the worst places to innovate in healthcare because of our public health system. It's slow. You have no idea how much pressure we're putting to bring that technology to market. But you'll see us very rapidly in the US, where it's easy because of the private health system to bring that. So that's where you'll see us next, is in the US. Yep. Um, so don't quote me exactly, because the wording are very important when you inform user for those things. Because BioTwin business model, we never share clinical information with the user. We share that with your health professional. If your health professional want to share with you, they need to approve it first. It goes through them. Um, we share lifestyle medicine because those are not considered medical advice. They're nutrition, there's lifestyle. For our research project, we'll take our phase three cancer oncology validation project. So if we track, then again, don't quote me, if you track that your profile correlate with breast cancer, that doesn't mean you have breast cancer. That doesn't mean we're detecting. Only a doctor can make a diagnostic of breast cancer. But what we're gonna do is we're gonna inform you that your profile during the validation oncology research project came up abnormal. We're going to assure you that does not mean you have cancer. It just means it's abnormal. And we think you should ask your doctor. And here's the information you should mention. And so you'll have a sheet. I'm not going to quote, but it's going to detail the information you're going to give your doctor. And it's going to clearly say BioTwin is not apt to make a diagnostic. We don't make diagnostics. But what we're seeing is abnormal. And we think you should talk to your doctor. And what your doctor will do, I was just yesterday talking with our family doctor or advisor, and she'll, okay, I might lose battery soon, but what she will do is she either prescribe a blood draw, she'll do a physical exam, and she'll validate. She'll ask you about your family history, depending on your age. She might send you for a mammography. It's going to be case by case, but she'll she'll manage it. And let's say you're 30, you wouldn't be in the screening program, but she might say, you know what, I want to review, I want to see you in a year. So there are different things that will be that could be done.
Yeah.
If I still have time for a question, but if someone somehow it does cut, I want to thank everyone. For me, and I told Aaron, it's a pleasure to present to you. I'm hoping, honestly, if I have a favor, if you can share BioTwin, whether it's on our LinkedIn or our Facebook or the website, with anyone currently diagnosed with pancreatic cancer. It's really hard for us to recruit users that are currently diagnosed. And I can understand that if you're diagnosed with pancreatic cancer, you may not have much time left, and helping research might not be your first priority. I understand that. But if we can recruit just 25 patients, we'll have a very accurate signature. And within a year, we could bring to market that technology. So any help you can make to make it, whether it's in the US or Canada, that would be awesome. And we'd love you for. So it's an opportunity for me to present to all of you today.